There are approximately 4.7 million registered nurses in the United States, making nursing the largest healthcare profession in the country. With burnout and emotional exhaustion still a significant part of the profession, OSF is looking for ways to help improve things across its ministry.
We are blessed to be in the most vulnerable situations many times with patients. And I think sometimes when you've been in nursing or you've been in a clinical role for a long time, you lose sight of how important and precious that time is when you're at the bedside with a patient, when they're making a difficult decision or just gotten a difficult diagnosis. Like, to me, that is such a privilege for us to get to do that.
That's Melinda Cooling, Chief Nurse and Advanced Practice Provider Executive for OSF HealthCare. And I'm Shelli Dankoff, your host for OSF HealthCare Accelerated. We appreciate you tuning in and remind you to be sure to subscribe, rate, and review wherever you get your podcast. Let's be honest, being a nurse can have challenges and be stressful. But along with the lows are the highs of making a positive and potentially significant impact on those they are caring for. At OSF HealthCare, we are always looking for ways to innovate and make things better, and thus the Nursing Innovation Fellowship at OSF Innovation was born. Joining me to talk about this exciting opportunity for nurses are Melinda Cooling, Chief Nurse and Advanced Practice Provider Executive for OSF HealthCare, and Nikki Graham, Vice President of Clinical Excellence for Nursing at OSF. Thank you both for joining us. This is an exciting thing. I know you both are very passionate about this, but before we get to the passion and explaining the program, you both came from the bedside nursing world. You've grown up through this. Let's talk a little bit about your careers first to level set. Melinda, let's start with you.
Yeah, I actually started my bedside nursing career at OSF at St. Francis Medical Center and did a wide variety of things, actually. I knew at that time I wanted to become a nurse practitioner. So I did bedside nursing. I did work inside of a skilled nursing care center while I was going to graduate school and did some ambulatory nursing as well. So wide variety. I would agree with you greatly that being able to provide care to patients at the bedside is something that does come with a lot of stress, but certainly a lot of rewards. And I think back about the many times that I had the opportunity to be at a patient's bedside during some really critical times and felt like I made a difference in their life, whether it be emotional or physical. So it is a very rewarding career.
Yeah, I'll second that. So my history started with the Army, in the Army Nurse Corps, and then went into emergency nursing and disaster relief nursing. And then I segued into psychiatric nursing before I came out of the bedside. I was at the bedside for a long time, about 15, 16 years. And so I love to be with people in their worst time, in their crisis, and just, be present. That's kind of my superpower.
And I was just going to say, boy, talk about stressful. Everything you said just checked all of those boxes about how stressful that is.
Little adrenaline junkie. Yeah.
Well, and over the years, I feel like for bedside nurse, and my mother was an RN, and she bedside for a while before moving into pharmacy. And I just feel like there were things that were different 20 and 30 years ago than what nurses are dealing with current state. Is that an accurate assessment? Have things changed, or has it always been this stressful?
Yeah, I'll sort of add my comments. I think many years ago, I didn't face some of the things I feel like our newer nurses face. When you think about the increase of workforce violence, patients with more aggression, the multiple chronic diseases that many of our patients have, the acuity of patients that we care for in our hospital settings, those have all made bedside nursing very different. In addition, I think that all of the things that we've done with EMRs, a lot of that is really great, but it's also brought about new stressors to our clinicians, really at all levels, right? So thinking about it's a great invention and it helps us provide care for patients, but it is a different sort of stressor. So I'm really excited about some of the future innovations that we see coming in that space as well to help alleviate some of those.
So let's flip to the Nursing Innovation Fellowship through OSF Innovation. And I became aware of this. So we've had the inaugural year has already passed. We're in year 2. So let's talk about what the genesis was and how this program was developed and what it was developed for.
We we're doing an initiative to get back to the basics of foundations of nursing. Sometimes when nurses get busy, things get pushed aside, right? And so when we looked at nursing, we noticed that a lot of foundational cares were missing. Simple things like brushing teeth, hygiene, right? Because they get so busy during the day. So we wanted a back to basics. And we knew that we needed to come to the elbow and really coach nursing and help them organize their day and make sure that these cares were done. But we're a small crew, right? And we thought, how could we really do this and expand it using peer coaching? Which, they're already working on the unit, and they have a lot more influence than leaders do, which is just a truth, right? Because they're actually doing the work. And so we thought, wouldn't that be really exciting to bring them in to do the peer coaching with us as we traveled across the ministry to really right-size this med-surg work? And then we thought also at the same time, wouldn't it be fun to infuse them with innovation, with understanding how to work innovation and bring that to the bedside with them. So not only can they change their practice, they also have view of other people's practice as they're coaching, and they would be able to really spot some opportunities for innovation. And so that's how we started, is just to create some peer coaches that could really do the work.
Yeah, when you talk about, you made mention of the ministry, I think that's the other thing that's important to mention. We have 17 hospitals. Mm-hmm. And so if you want consistency, because the goal is that no matter where you touch OSF HealthCare, you're getting the same consistent care across the ministry. But we go from Upper Michigan down to Alton, Illinois, and then spread the borders of Illinois from Iowa to Indiana, really through the central part of the state. And that can be hard to keep everybody consistent because communities do things different, and our rural communities do things a little differently than our more urban settings. Was that also some of the mindset to get this consistency going?
Yes. And some, nursing, the foundational nursing is foundational nursing no matter where you are. And so with our pilot group, we chose 6 nurses, and we chose them from the CRT, our float team, because they're used to going across the ministry and just assimilating quickly into the unit and doing their work. So they already had those characteristics, and that made it a smoother transition for them to go in. And then we also offered them some classes on how to coach, and then an 8-week internship at the Innovation Fellowship. They've also had a special ethics course and how to team.
So when you say you selected them, did they apply for it, or did they express interest, or did you? Because again, we have a lot of nurses that work for OSF, and so if you had to sit there and go, ooh, how do you narrow that down?
Yeah, it's no joke what they go through to get into the Nursing Innovation Fellowship. So first of all, they have personal metrics that have to be high. So things like scanning their medications and things. Their managers have to can elevate them because of that. They write a personal essay that's 1,000 words. They get a recommendation from their CNO, and then they sit through panel interviews. And
that's some serious stuff.
Yeah.
And by the way, they're still at the bedside caring for patients
100%.
Because we're still working our normal shifts.
100%. And then, so they go through all of that, and then, we select 6 out of 19, 20. So.
And you have to be committed to do this too. Yeah. You have to know the extra work it's going to add. But when you guys as the leadership team looked at it, were you excited about what the potential was, but you really didn't know when you were developing it? Because you can put it on paper and go, wow, wouldn't it be great to do this? But then in reality, you don't always know what to expect or how it will go, do you?
100%. I had no idea that it would be as fun as it was for me, for them. Yeah, had no idea how successful it would be. It was just, a wild try.
I think the framework that OSF has built over years of just innovation in general, like we have such a spirit of innovation. We're blessed with a massive innovation center with a lot of innovation expertise that we've brought to our organization. And so that sets the background, right? And then helping understand, having a nursing leader like Nikki who really thought about this and said, let's try this. If it fails, it fails, and we move forward. And that's really hard for healthcare. in general to do is accept failure. But, I give her a lot of credit for having that innovative mindset to say, hey, I need some bedside nurses. They're the ones who are going to be able to really influence their peers because they're working along the bedside more so than I can. And so really having that innovative thought process, using the resources that we already have within the ministry, and then bringing the nursing leadership team alongside of that, I think has been really powerful for us to build this. So, and then being able to pivot and say, this worked really well, this didn't, so how are we going to sort of reshape it and do it differently? And I constantly hear her, sort of reflecting and challenging herself on like, how can we continue to build this in the future? So I think that it's, all of us have to have that innovative mindset and sort of the ability to say, like, we failed at that, or we need to pivot, or we need to do something differently. So.
Because it's not a one and done. So you had your inaugural class last year. Mm-hmm. So where are they? It's what, a 3-year?
It's a 3-year now.
So they started last year.
They didn't know that when they started.
Oops.
Yeah, we didn't either. So,
with the training, with everything. Wow. Okay. So the same commitment every year from that cohort. Yes. But yet they change a little bit of what they do, correct? Yeah. Walk me through that. So year one, they come in, they get thrown all this stuff. Okay, let's figure this out. Here's your training. And then they've now shifted into year 2.
Yes. So this is a good time to call out that this has been an all-in ministry. We have had help from every crook and cranny here, including the innovation team, which is amazing. Right? We said, hey, we want to do this. Could you build an 8-week class, or, could you build a class, however long it takes, right? And take these folks through and teach them about innovation. And they were like, yes. And so, right, in healthcare analytics, they're doing some really fun data work with them. Like, it's been everybody.
Fun data work. I love people who use the words fun and data in the same sentence.
They are making it fun.
Like, good.
They're the innovation fellows. Yes. Yeah. And, we asked for an ethics course. Everybody has said yes every time that we've asked. So I just want to be really clear. This is a full mission, all hands on deck. So, and everybody has been completely gracious. So yes, so you come in and you're completely overwhelmed because we're talking about all kinds of things and they're like, when do we do all this? Your first year, you continue to work 2 shifts on the unit. And then you have 12 hours for innovation. And I think you alluded to that earlier, that you have to be very flexible because it's not another 12-hour shift. It could be an hour here, an hour there, a few hours here, right? And so the rest of your time is kind of ours. So that creates, that's a barrier for some people just in and of itself. And so you come in, we get you into innovation right away, 8 weeks of innovation where you spend a day every week with the innovation team over at Jump, which is really fun. It's just downhill from there, but because they're really fun. And then at the end of that day, we tack on something else. So maybe organizational development, coaching support, where they actually go and practice coaching with a standardized participant. And then maybe it's healthcare analytics data class, maybe it's a documentation course so that we expect them to be at the top of their practice too, so we make sure with bringing in our informaticists and such. So every day is full for them. Then they spend time also with their preceptors, which are the Innovation Fellow 2s, and so they talk about what they need to do and sign off on all of their competencies. So, but the competencies run the 3 years. So
okay, so they've come out of year 1 with all that. So now that initial cohort that's in year 2, walk me through what they will be doing this year.
Sure. So we're preloading them with curriculum right now, and they're in the Teaming Innovation Lab with Ann Williamson Dunlap, and it's really bringing out self-compassion for how to create team. And then they're also doing an asynchronous ethics class. And then when they're done, their second year is really wrapping around a nursing problem and thinking about it differently and working with the innovation faculty to really push them out of their usual thinking patterns.
And potentially solve whatever problem
100%.
Exists. Well, that's the goal, is to solve the problem.
It is. It is. And We've had 1 nursing practice change and 1 invention just from the first year already.
That's amazing.
I know, it's exciting.
Was that exciting when that happened? You went,
yeah.
But you knew it was out there because, again, the bedside nurses see the problems or
Right.
the challenges that are faced. And how often do they say, there's got to be a better way to do this?
Right.
And that's what this gives them the opportunity to figure out.
Yes,
with
and then
other
to have a
support.
peer coach to
Yeah.
get them there if it's not the actual innovation fellows.
So in their second year, now I know we have welcomed in our new class. So do the second year people start mentoring the first year people?
Yes.
Okay, so there's this trickle down. So it's like a
Yes.
round, like you sing a round, it's now the next one or bringing them along. So they're supporting the people who are them from last year, right?
Yes.
Okay,
Yes.
that must be fun to watch and interesting.
It is. It's fun to watch. It's fun to watch because now the second year are a little bit overwhelmed at the beginning, right? Every time you start something new, it feels overwhelming until you get in your rhythm. But they're starting to feel like that. And then at the same time, comforting the first year is like, it'll be okay. It's going to be so much fun.
And then what will happen in year 3 for this first
Yeah,
group, which will be next year?
It's a good question.
Okay, more to come on that one. And that's what's called a tease, folks. So we'll get back to that. But I suppose that's part of the excitement for the two of you to be like, okay, on paper we think this is what will happen, but you really don't know, do you? You're building the
don't.
ship as you're flying it,
Yeah,
right?
I think, one thing is I feel like from my seat, I feel this is a way for us to build sort of the spirit that already lives in within nursing, which is lifelong learning. Right? They tend to be lifelong learners anyway, but the more that we can influence them, whether they stay at the bedside or they move into nursing leadership, like building these competencies in them is really critical for them to understand the why the organization has to shift or why we're putting focus in one area or the other. To me, it's building the strategy, whether they realize it or not. It's building the strategic mindset, the innovative mindset, that I'm a lifelong learner, I'm a change champion, like healthcare is not going to stay the same. So how do I wrap my arms around that and help my nursing colleagues move through that? To me, from my seat, that's what I view as one of the biggest benefits.
I have to believe it's also a morale boost because, again, you can get stuck in a rut, any position for anybody. And if somebody says, here's this opportunity, oh, wait, I'm really listening to you. I hear what you say. You can affect change. And then you go tell your unit at whatever hospital. We're not at one hospital. We're pulled from all over the place, which has got to be fun for them to interact with people from across the ministry. And you learn from that. But then to actually be heard and acknowledge that, yeah, oh, wait, we were having this problem in Monmouth. Oh, wait, we were having this problem in Rockford. Oh, wait, let's figure it out together. Because sometimes you feel like you're in a bubble and you think you're the only ones having the problem. And then to be heard by leadership, no, we're going to let you help us. You're going to help us solve the problem when we are listening to you. That has to be a great morale boost for those on the floor, right?
It is. The two comments, excuse me, that I would say in response to that is we have one innovation fellow who is in the first year, and she said she had one foot out the door because she was looking for something different. And so now she's with us, and she's an excellent nurse, human being. So really excited to keep her. And then from the first crew, during the first year, they said, we had no idea all the things that ministry was doing to help nurses. We had no idea. And so they're out being ambassadors for the system, right? Saying, we're working on it. They're working on it. Let me tell you what they're doing to try to fix these things. So those two things are really good for the ministry.
Yeah, I think sometimes, in any clinical field, you can sort of get siloed into thinking like it's only about my unit or nobody cares about my unit or my hospital, but giving them the perspective of how the system has to look at things and how we have to really devote time and effort into discerning through the decisions that impact all of our hospitals. I think about any decision I make that may impact every nurse across this ministry, that takes time and discernment. So for them to be able to see that, I think the other thing is we're really going to spend some time celebrating them. So at our I Am an OSF Nurse Symposium, we're making sure that they're there. We're going to celebrate them because in my view, these nurses they've all sort of put their foot out there and said, I'm willing to try this. I'm willing to contribute to this. I'm willing to learn alongside of the leaders to build this program to not only benefit me, but to benefit nurses in the future. And that takes a lot of guts to do that. It takes a lot of, boldness to be able to step forward. So I want to definitely celebrate them for the efforts that they're doing and really try to give them the spotlight for what they're contributing to our ministry.
Well, I remember at last year's symposium, we recognized there was one project they had worked on that went across the ministry, and it is escaping me right now, but they were so excited, and you could see the rest of the nurses in the room that were like, oh, yeah, there was that, and there was this recognition that it had an impact. And that was just from the first year folks, that they had done something just to address what was seemed like a major issue that they simplified and went, okay, and then they got it solved. And it was kind of neat to watch everybody excitedly talk about that accomplishment. Is that good for the two of you to hear too, is them taking the ownership and just how excited they are about this?
Yeah, it's that brings me joy. That's the part that brings me joy, is how excited they are. And I just want to say, to Melinda's point, they are so brave, because they would ask me what this is going to look like, and I'd just be like,
I don't know, you tell me.
That's what I
Building
said.
the plane while you're flying it.
Yes, exactly. And they were like, okay. So, I mean, that takes a lot of courage.
Well, and you see this happening, just continuing forever and ever, right? Now that we've got the ball rolling, it's, as you said, going down the hill. Yes. We'll get to year 3 and just being even bigger mentors. I'm guessing when they transition out of that program after year 3, they'll probably miss it.
I'm sure. I'm hoping that
We hope so.
Yeah.
And keep coming up with ideas
That's right.
and stuff. Yeah, okay.
Yeah, exactly.
Well, anything we haven't talked about that you think is important for people to know about this initiative and the excitement around it for the two of you? Anything I've missed?
I think for me, I would just, comment that I really want to build this excitement in all of our nursing community and really help them. To your original point, we are blessed to be in the most vulnerable situations many times with patients. And I think sometimes when you've been in nursing or you've been in a clinical role for a long time, you lose sight of how important and precious that time is when you're at the bedside with a patient, when they're making a difficult decision or just gotten a difficult diagnosis. Like, to me, that is such a privilege for us to get to do that and be there for families. And anybody who's had a family member that has been in those situations, I reflect many times my entrance into nursing was because of a nurse. So my choice to become a nurse was because I was touched by a nurse who took care of a family member. So I just challenge our nurses to really think about, don't ever underestimate the power that you have and the influence that you have over a patient's care.
Mm-hmm. People remember.
That's right.
They'll remember you by name.
Yep, forever.
Right?
Ever.
Yep.
Nikki Graham, Melinda Cooling, always an interesting conversation when I bring in people from the nursing side of things, and particularly related to OSF innovation. It's just so very exciting. Thank you for being with us and sharing
Thanks
this
for having us.
wonderful
Yeah, thank
program. And thank you for joining us as well. And remember, you can find all episodes of OSF HealthCare Accelerated at osfhealthcare.org/accelerated.